Hey everybody, welcome to this week's case of the week. I'm going to be sharing a patient story with you on how this idea of longitudinal sleep testing or continuous sleep testing can help us develop some very cool insights. So this patient today, he's 66, he has a history of hypertension, kidney stone, history of insomnia, BPH. He's on appropriate medications for everything. And about 10 to 15 years ago was diagnosed with mild sleep apnea, was prescribed a CPAP, had some intolerance, has not been using it ever since. He connected with us recently and is going through the multi-night testing process. So let me share this information with you. So here is the patient dashboard, and we're going to look at this data across time. And so on the left here we have the apnea indices in red, these bar graphs. On the right here we have the sleep quality across time. And the first night he did a sleep test, you can see he thankfully he had journaled. There was alcohol, heavy dinner, and you can see the apnea indices are moderately elevated, suggestive of moderate obstructive sleep apnea. Sleep quality is moderately reduced. Afterwards, when he started tinkering with his trazodone, you can see that increased the quality of sleep from like the mid-20s to the low 30s. And when he did not take the trazodone and consumed alcohol, you can see how sleep quality substantially dropped. Apnea indices were about the same. And when he started combining a nose dilator and lip tape, and the idea here is that helping promote nasal breathing while preventing tongue collapse by keeping the mouth closed, we can see that in him at least, and also the absence of alcohol, that lip tape, nose dilation, continuing the trazodone, there was a substantial reduction in the apnea indices from around 28 to down to 11. So pretty significant. And as you see this over time, if you added trazodone to the equation, then not only did the apnea indices stay about the same, but the quality of sleep went up substantially from like the mid-20s to almost 40, so almost 100% improvement. And we can see that over the course of time, as compared to the original study, with the combination of lip tape, nose dilation, prescribed medications, the overall quality of sleep was substantially better. He was sort of categorized from this idea of moderate sleep apnea now to mild sleep apnea, and this is very helpful information for us to have, both the patient to have as well as the providers to have. And if we look at him now, this combination of lip tape, nose dilation, maybe a higher dose of trazodone is resulting in a consistent improvement in the quality of sleep, a consistent reduction in the apnea indices. There's still substantial room for improvement. I think he's open to trying CPAP, but if we can help him optimize his sleep apnea and help him optimize his quality of sleep without having to use a CPAP device, I think that will be very cool. There is still room to experiment with dental appliances. There is also, as I mentioned, room to experiment with body position. And there's also room to experiment with, it's called orofacial myofunctional therapy. It's exercises of the tongue that prevent it from falling backwards. And then there's also electrical stimulation devices that can be added to this. So as we help him develop this sleep stack that allows for higher quality of sleep, lower apnea indices, it'll be really exciting to see his journey, and I'll keep you guys posted on how he does. And thank you for watching. Talk soon. If you have any questions, please don't hesitate to reach out to me directly or the care team. Take care. Bye bye.